On this episode of 26 Minutes with Dr. Warren Seigel, I'm joined by Ms. Karen Walsh. Today, we'll be talking about a vital topic, the importance of breastfeeding and human milk for our newborns as a way of fostering a long-term bond and relationship with our children. Together, we'll explore the numerous health benefits from strengthening a baby's immune system to fostering the long-term developmental health of newborns. Ms. Walsh, thank you so much for being on the show today.
I'm so honored.
So tell me a little bit about yourself. Where did you grow up and how did you get involved in breastfeeding?
So I was born right here in New York City, and I grew up right in this community in Brooklyn. I lived here my whole life, and I love everything about Brooklyn and New York City, so it's fitting that I wound up working here and giving back to my community.
So your title is lactation consultant, is that right?
Yes.
Can you explain that? When I think of a hospital, I think of nurses, I think of doctors. I don't think of a lactation consultant. Explain what your role here is at South Brooklyn Health.
Sure. So I am an international board certified lactation consultant. And my role is to support mothers in their journey in human lactation and breastfeeding.
So what does that mean specifically? So a mother comes in and she's pregnant, she delivers her baby, and at what point do you get involved in her health?
So I'm typically called to births to make sure skin to skin is happening, which means following a birth, baby will be placed skin to skin with his or her mother. And they will usually call me to make sure that skin to skin is happening and baby is starting the natural process of latching on right from the beginning.
So when a woman is in labor, they're going to call you? Are you involved in that decision in prenatal care, for example? I would imagine that the idea of how to give nutrition to my newborn has to happen before I'm in labor, right?
You are absolutely right. So those conversations do start in prenatal. So everybody from the provider to the nurse to me, we all have that conversation with the mom when she's pregnant, because typically women will decide how they're going to feed their babies during pregnancy. So our relationship starts then.
So tell me a little bit about that conversation. Why should women, new mothers, and we'll talk about other ways of feeding babies, but why should new mothers think about human milk as the best form of nutrition for their newborns?
Human milk, in its most simplest form, we're human beings, and human beings need human-specific milk. So that's my favorite answer to that question. But what makes breast milk so special is, first of all, only mom can make it for her baby. And it's not only species specific, but it's so specific for that mom and that particular baby that the baby will actually communicate with the breast through its saliva so that the mom can then make a milk for that baby that returns exactly what that baby needs in that given moment. So it can actually be that specific. But in general terms, human milk, we as human beings make antibodies in response to pathogens. And we pass those antibodies through our breast milk. So we are preparing the baby's first immunization. We're preparing the baby's immune system to fight pathogens, diseases, acute illness and infection, and lifelong diseases and conditions. So not just in the now moment, but you're setting that baby up for a full lifetime of health.
I've always loved that expression, it's the baby's first immunization, because as you said, it's a natural way for newborn babies to improve their immune system.
Yes.
But you said it's specific to my mom? It's specific to, how is that? How is that? So the more that baby sucks at the nipple, the more the mother makes specific milk for that baby?
Yes. It's incredible.
It is incredible.
I am always in awe of the science behind human lactation, which is one of the reasons I got into doing what I do.
Let's back up a little bit. How did you get involved in this? This is, I often will say to young kids, what do you want to be when you grow up? And I've never met anybody say I want to be a lactation consultant. How did you get involved in this, and what brought you to this field?
I didn't even know it existed. until, I lived my life on a path towards something else, and I had a baby, and it changed my entire life. And having that first baby taught me many things, and one of the things that it taught me was there was a complete lack of support for something that I just knew instinctively that I wanted to do. Not necessarily at the time knowing that it was necessarily the standard or better. I just knew in my heart I wanted to breastfeed my child, and there was no support at that time. And in that moment, it was almost like when my child was born, I was born as a mom, but I was also born in such a way that I knew this is what I wanted to do with my life. I wanted to get involved with changing the way we empower mothers, the way we support families, and the way human beings start off in their lives. And this was my calling, so to speak.
That's a really incredible story, because, clearly everybody who has children, our lives change. Whether you're a man or a woman, whether you're a dad or a mother,
100%.
whether you're a grandparent, aunt, uncle, everything changes, but you use that moment as a way of finding a professional path, not just a personal path. Let's back up for a second.
Sure.
I wasn't breastfed. In fact, my generation, my guess is breastfeeding was not, the standard.
It was not.
Why are we hearing more and more that breastfeeding should be the standard and formula feeding and bottle feeding should be, secondary? What do we know? Why is that changing?
Well, again, I'll piggyback on what I had said before. Human beings need human-specific milk. And over time, we're recognizing now that a lot of the chronic disease that we are seeing now in people that are approaching their 60s and 70s are from a generation where you can trace back that most of them were not started out with breast milk. And a lot of their health conditions can be linked back to that. So worldwide recommendations were a little bit different than what was happening in the United States, starting with the 1940s and 1950s. And it was a complete switch from what we have done as human beings for millions of years to present, where it was so many factors came into play to change that. But in the long run, we started to see that now we're recognizing that there's health problems. It's an epidemic. Even the health department talks about all of these people that are facing diabetes and hypertension and cardiovascular disease, and they're linking it back to the fact that they were not breastfed.
So you're saying that if I'm a new mom and I nurse my baby, if I'm giving them human milk,
Sure.
and we'll talk about breastfeeding versus bottle or pumping and giving human milk in a second, you're saying that there are positive health benefits for the baby, including decreased diabetes when they get older.
Absolutely.
What else did you say?
Cardiovascular disease, diabetes type 2, and not just in the child. Mom, too, has lower risk of reproductive cancers, even ovarian cancer, uterine cancer, breast cancer, cardiovascular disease and diabetes for her. But getting back to the baby who will become a child and an adult, a setup for lifelong health. Less incidence of chronic disease later on, including allergies and asthma and even cancer.
Wow. So it's not just for the baby, it's also for the mom.
For both.
That's incredible. I mentioned that there's a bonding that goes on when you're breastfeeding. Can you talk a little bit about that?
Sure. It's not just about physical health, though breast milk contains all the nutrients that a newborn baby requires. But it's not just about nutrition, and it's not just about lifelong health in a physical sense, but the psychological health is so important. And it's that attachment that's formed between mom and baby that sets up the stage for relationships later on. And it starts with the breast. It starts with that attachment. And there's so many emotional benefits. Moms are responding to their newborns. They're learning what their newborns need, and they're empowered by that. I can't tell you how many moms I have come across in the 20 years that I've been doing this that feel that their whole life has changed because they breastfed their baby. Mm-hmm. It's so empowering for them as women, as mothers. and then they're passing that onto their children.
So why do we have a thing in this country about breastfeeding? I remember many years ago, in Europe you would see women breastfeeding in public. Here you never saw that. As I say, I grew up in a generation where everybody was bottle fed. Why has there been this stigma before this?
Social stigma around breastfeeding. Well, in the United States, as compared to the rest of the world, I can't say every country, but as compared to the rest of the world, the breast is sexualized in this country. So, and for many generations, we have not breastfed or been breastfed. And now that we have 3 or 4 generations where it's not the mainstream in our society, though I hope it's starting to change, when we see a breast and a nipple, it's like, oh my goodness, and now you have a baby suckling on a breast and a nipple. And not everybody, because I don't want to generalize, but some people may see that in a sexual way, especially if it's an older child. Breastfeeding in other countries, the norm, it's not uncommon to see a toddler breastfeeding or a child, into the 2nd or 3rd year of life. But here, something triggers people to think of it in a sexual way. So it carries a completely different connotation. So it was very shocking to start seeing moms now sitting, just as we are now, sitting in the park, having some, tea, coffee, and kids are playing, and mom takes out a breast and starts breastfeeding. So the whole connection of sex and breast need to be unlearned, if you will, because it's a social construct.
I love that answer, but the other thing that I like to remind people is this is the most natural process in the world. And I love what you said. As human beings, this is what babies need. We would never think of an animal getting a bottle.
Exactly.
You go right to your mom. It makes sense. But let's step back for a second. There are clearly moms who can't breastfeed, right? Are there medical reasons that some women cannot breastfeed their newborns?
There are a couple of exceptions, yes. I want to say galactosemia. It used to be HIV moms could not breastfeed, though that is changing. It used to be in the developing world that because the baby would be at risk to die anyway, and if they do not have access to a safe water supply and safe formula, then breastfeeding is survival. Here in America, because we for so many years had a safe alternative, that was different. But now, with World Health Organization guidelines and the CDC, we're now learning that there are safe ways for an HIV mom to breastfeed in the United States, if she wants to, in conjunction with monitoring and seeing her doctor and making sure that she's okay in terms of viral load.
So if there are no medical contraindications to mom breastfeeding, would you advise every mom to think about breastfeeding?
Absolutely.
What would be the most common reason moms would say, you know what, I thought about it, but I can't do it? Well, it sounds hard. And I have to tell you, as a dad who remembers that 2 a.m. feed, and we fed, it was formula, I enjoyed that feed, but I didn't enjoy getting up at 2 o'clock in the morning. So I can't imagine breastfeeding a baby. Well, what are the things that moms complain about mostly when they are thinking about breastfeeding and say, no, I can't do this?
Well, a couple of things come to mind. The first thing that comes to mind is our lack of maternity leave in America, although that's starting to change, so I am excited about that. But when we have to go back to work, it becomes another challenge. I myself breastfed my 3 children and managed to come back to work and find a way to express milk at my job and continue breastfeeding at home.
When you say express milk, you're talking about pumping
or
store
hands
it,
expressing.
and then
storing it and bringing it home the next day for my caregiver to then give my child.
Which is a nice way for dad to actually be involved in the process.
Of course, there's many ways for dad.
Although I
to get
didn't like
involved.
getting up at 2 o'clock in the morning.
No one likes to get up at 2 o'clock in the morning, and everything goes wrong at 2 o'clock in the morning. Doesn't matter how we're feeding. But so going back to work is a challenge for moms here. although there are now more laws in place to protect moms at their jobs who choose to come back to work and express milk. But I would say the number one reason I hear from moms as to why they're either supplementing with formula or choosing to formula outright would be because they somehow don't think they are making enough milk. And we know through research and observation and our clinical research, we know that that's really not the case. While we respect every mom's right to choose how to feed her infant, and we certainly don't want her leaving the hospital feeling inadequate or that somehow her body is failing her and not, doing what her body was designed to do, it's very rare to actually have clinical low milk supply. Breastfeeding is supply and demand. The more the baby sucks, the more the breast will make milk. So in fact, when we start to supplement, then naturally over time, the body is needed less and then it produces less. But in those first early days, during a very vulnerable period of time for moms, it's so important to empower her and not so much make her feel like it's all in her mind, but we want to make sure that moms know, don't worry, it's okay. The baby's stomach is very, very small, and the milk that we have in those first early days, even though it's a little bit, it's perfect. It's nature designed human beings. As mammals, we're mammals. We make milk for our babies.
That's very interesting. And you made the point that the stomach is so much smaller.
Yeah.
So although I think I need a gallon,
Right.
I really don't. In fact,
No,
if
you
I
need a
gave,
teaspoon.
I was going to say, if I gave that baby a gallon, he or she wouldn't
Would
take it
throw it
anywhere,
up.
would get sick and spit it up.
100%.
And the more that baby sucks at the breast or pumps,
Right.
or the mom pumps, which we'll talk about in a second,
Sure.
the more more milk she's going to make. Huh, interesting. So another common reason for women not to think about breastfeeding is I work. And you're saying there are ways around that. And
Correct.
can you talk a little bit in New York City, which is where we are?
Yes.
Are there protections for women to be
Yes.
able to breastfeed on demand?
Yes. So the Pump Act, when we come back to work, protects women in all 50 states now. They revised the laws in December of 2022 to include workers that previously weren't covered, like teachers, like nurses, like retail jobs. So despite the fact that we may not have our own office to go back to or the time to do it, now the law says we can express our milk as needed at our jobs.
So it covers you
It covers
being
us.
able to breastfeed your baby on demand wherever you are,
Yes.
as well as time to express milk if you have to use it at a later time. And that's in all 50 states. I did not know
Yes.
that. That is wonderful. So we're really seeing a shift in this country to try and do what's more natural. It's interesting. I remember talking to a mom years ago who came from another country, and one of the things she taught me is she said, in my country, poor people breastfeed. People with money buy formula. Can't get any cheaper than free, right?
Right.
Interesting.
That phenomenon has fascinated me for years, and I'm actually doing research right now on studying immigrant populations that come to the United States that would otherwise be breastfeeding in their country, and why do they come here to the United States and seek otherwise, whether it's supplementing or outright formula feeding. And something you said just now reminded me that a lot of that has to do with the fact that it's unattainable where they're from, and it's seen as a status symbol for the rich.
Sure, it makes sense.
So that's part of it, though there are certainly other factors that go into that decision when they come here. But it is definitely something that's very exciting to study, for sure.
Really interesting. I touched on the dads, the significant other who really wants to be part of this process.
Sure.
What do you say to women, men, same-sex couples who really want to breastfeed, give their babies human milk, but can't do it for whatever reason? Are there other alternatives?
So when you talk about the support of the partner or the dad or even grandparents who everybody wants to be involved with the newborn, they want to feed, they want to hold, they want to love. And in the beginning, maybe during the first 4 to 6 weeks, we let breastfeeding establish itself with the mom. That way supply becomes what it should be. The baby doesn't get confused with another nipple, because sometimes that can happen where the bottle is very fast and then the baby might end up rejecting the breast. So we usually advise people to wait a little bit. And then after about 4 to 6 weeks, we let somebody else introduce the bottle, or the mom if she wants to, for a much smoother transition. And now in the beginning, for those first 4 to 6 weeks, we tell dads or partners or grandparents that they can be involved in many things. Skin to skin, let's say, for the baby, which helps regulate heartbeat and breathing. Bath time, diaper changes. There are so many ways for partners to bond with baby that doesn't involve feeding. But a little bit later, they can absolutely, get involved with that, with feeding. Now, you touched on same-sex couples, so I would love the opportunity to talk about that. Lately, we're now seeing so many different options for same-sex couples, and I'm so excited about that. So let's say, for example, you have a lesbian couple where they've decided one will carry the baby and make milk naturally, and then the options for the other mom, if she wants to do it, and if they've discussed it and decided this is what they want to do, we can either induce lactation for her by pumping and hormones, in accordance with her doctors, or they can obtain donor human milk if they're interested in feeding donor human milk. So they could have the experience of feeding the baby too. Maybe the milk would be coming from a bottle, or if they wanted the baby to suckle at their breast, there are ways we can do that also.
Wait a minute. Donor human milk.
Yes.
Explain this one to me. Somebody donates it and I go and buy it, or how does that work?
So it's a little different. So it depends on the situation. So let's say for blood, for example, you need blood. You're in the hospital, blood is donated. It's put through a rigorous process of testing and making sure that it's healthy by infection control standards. The same would hold true for human milk. Human milk is donated. It's put through a pasteurization process. It's handled by the Human Milk Bank of North America, and they put it through the same process that they would blood. So most of that donated human milk does go to NICUs for compromised babies, for premature babies, sick babies.
So the NICU being the neonatal intensive care unit.
Yes.
Okay.
Yes, thank you. But for couples that want to use human milk instead of formula, they have the option to purchase it.
So really, it sounds like there's less and less reasons not to breastfeed.
Sure.
Less and less, and yet there's still this pushback against breastfeeding, although that tide is changing. Can we talk a little bit about, I know that South Brooklyn Health and many hospitals all over this country are called baby friendly, and they've been designated baby friendly. Can you tell me what that means and how that is related to breastfeeding?
Sure. So the Baby Friendly Hospital Initiative was an initiative started not just here, but it's an international initiative, and it involves many different countries. It started off with the World Health Organization and United Nations Children's Fund, and they worked together to set up guidelines to protect the interests of children, first in other countries, and then here in the United States. So it's a set of steps. It's 10 steps to implement the best practices for infant feeding in the hospital setting. So that means that in terms of South Brooklyn Health, we worked for many years to achieve this goal. It was something started in 2006 across New York City Health and Hospitals, started by Mayor Bloomberg, because at the time he prioritized health. And one of the things he did for our city was he wanted all 11 acute facilities in the system to become baby friendly. So it was changing a culture, changing the way providers practice, changing the way nurses practice, changing how we're educating patients and implementing patient-centered care, and implementing these 10 steps towards successful breastfeeding.
So really what we're talking about is a public health shift, making sure that babies are getting the best nutrition that they can, meaning human milk.
Absolutely.
Getting the best start off in their life to decrease all the diseases that you talked about is also that the mom has significant benefits. And once again, you're talking about a shift in our culture, in our society, to allow moms to be more successful in breastfeeding. They can go back to work. They can find other ways of pumping and making sure their babies get human milk. I have to tell you, I can't think of a better way for you to have decided what to do with your professional career. And I want to thank you, not only for being on the show, but what you're doing every single day, from prenatal care right until postpartum care.
I can't think of a better way to lead my life than empower moms to make informed choices for their families and to be part of that journey and support them in their decision making. And becoming a mom is such a special gift, and I'm part of that. And my best reward is when they tell me that I've changed their life somehow, and I was an integral part of her and how she cared for her family. And they'll see me in Stop and Shop like 10 years later and say, oh my God, I don't remember your name, but you helped me breastfeed like 15 years ago. And I'm like, wow, that's my gift.
Well, thanks for what you do.
Thank you.
That brings us to the end of our program today. We thank you for tuning in and learning alongside of us. For more information about our show, please call 718-510-2103 or visit www.zormed.com. Stay updated and engaged with South Brooklyn Health by visiting us online or see the URL on the screen. This broadcast was brought to you by Brick Media in partnership with South Brooklyn Health. Thank you for watching, and for now, be well.